I am very happy today to speak to the fantastic candidate for the NDP here in Kingston and the Islands, Vic Sahai. I think he's going to be doing a great job, but one of the things I want to do with this chat today is introduce you to Vic, what he brings to our community, what he brings to the NDP, and what he's going to bring to Parliament. So Vic, thanks for joining me.
My pleasure. Thank you for doing this.
Vic, you have an experience a lot of people do. My father was an immigrant as well, and you have emphasized that, you are the child of immigrants. And what do you feel that brings to your experience as a candidate, as a citizen, as a worker? What do you think that brings to your daily life that gives you a perspective on the Canadian experience?
I think one of the things that happened in the indentured laborers is that my ancestors moved from India to Guyana, and I understand from that experience colonialism at its source. The other thing is that when I came to Thunder Bay, I grew up in Northern Ontario, where I understood the plights of the First Nations and the Indigenous peoples, and I was able to really understand how colonialism affected that group of people. And when I grew up I raised my kids in Sudbury, for example, it was also an opportunity for me to expose them to a different culture, and how those cultures actually blended together in what we call a Canadian culture. That is, as a son of an immigrant, and being an immigrant myself and raising my children, it just gave me a different perspective of what Canada is all about.
That's fantastic. And I definitely think that there's a growing awareness about how historical oppression for people all over the world shares a very real connection. Differences, of course, exist, but shares a real connection with the ongoing struggles of Indigenous Canadians. So that was a great job kind of building that connection. In terms of Kingston, so when you came to Kingston, why Kingston? What do you love about Kingston? How was it, setting roots down here in our great city?
I went to school in Kingston, so I'm a graduate of Queen's University, and then I went to Sudbury after I graduated. My goal was always to come back to Kingston. It is a city that I absolutely adore, and I should say it's not just Kingston; it's Kingston and the islands. I just absolutely adore the culture, the brilliance of the city, the diversity, or I should say the growing diversity of this city, the people. It is a city that has everything, admittedly in small pieces, but it's also situated perfectly in terms of we're only about an hour and a half away from Ottawa, Montreal, and another couple hours from Toronto. And it just seems to me that everything just blends together in this beautiful city. The other thing, too, is the different aspects of the city. We have a military population. We have Indigenous communities as well. We have a French-Canadian community. The people who work within the government themselves, business communities, and all of these diversities make Kingston such a wonderful, wonderful city.
One thing I want to bring up is that, in politics, personal histories matter, and family histories and family situations matter. And you have a son that's very exceptional in a lot of ways. And I would like to know how that exceptionality, and maybe you can elaborate to the listeners, shapes your perspectives on life and on politics.
Yeah, so Alex is the love of my life. I have two sons, Alex and David. David is a very bright young man who is just starting his medical career. So he is starting medicine at Western University and is doing amazingly well, especially in this first week. Alex is autistic. He's neurodiverse, special needs, severe autism. He is also epileptic, and he does have fits of violence. And one of the things that Alex has taught me is unconditional love. He has taught me that if you love someone, you will work endlessly for their well-being. And I have done that. My wife has done that. He's also, through Alex, I've also learned how to advocate for the most vulnerable in our society. We have a hodgepodge of healthcare systems. And one of the things that I found very difficult, and you have to understand that I've worked as an epidemiologist and in healthcare all my professional life, and still navigating those silos, not having Alex fall through the cracks, was a Herculean experience. It was, sometimes it was devastating for us, but when we found the help, it was adulation. One of the things that I've learned throughout this whole process is that we do not have a perfect healthcare system. We fall through the cracks, especially a person with Alex's disabilities. Mental health, for example, is a huge issue in terms of getting resources. But when we fought for it and when we got it, he is in a better place. Now he's in a home in Gananoque, and I have to thank Anguanata for doing an amazing job helping our family and taking care of Alex. Even a simple thing like Alex turned 17. He went from 17 and turned 18. We actually had to transfer his money or his resources from one agency to another agency. And that was just a very difficult, frustrating experience. But when you take things one step at a time, when you get the help and the advocacy that you need, it is doable. And we did it.
I think that's an incredibly important perspective. And I think that, a lot of people see healthcare as a kind of purely provincial responsibility. But I definitely think that in the federal campaign broadly, we're seeing a push to ensure that the care for the most vulnerable be given a greater priority at the federal level. And a lot of the focus has been on people in long-term care facilities, particularly within the lens of COVID. But I think, this is a broader issue about how we allow profit motives and how we allow the marginalization of people who often can't represent themselves to lead to really ugly situations. And I think that there is a role to champion that next frontier in building, a universal healthcare system.
One of the things that I really want to talk to you a little bit about is that healthcare cannot be in isolation of other policies. So, for example, we know social policies affect your health. Poverty, whether or not you are have an Indigenous background, whether you live in Northern Ontario or Southern Ontario, the color of your skin, education, all of these things influence whether or not you are healthy or not. So when we talk about healthcare, we also have to knit that into our social programs. And I'll just give you an example. Housing, for example. When we have a housing policy, it isn't enough just to have a robust housing policy. We have to look at our addiction policy, our mental health policies, our Indigenous policies. Because if we have all the housing in the world, but we neglect the social policies that affect housing, or affect our ability to access those housing, we know that we are going to fail. So when you are completely right in saying that health is not just about the delivery of services, but ensuring that people have the resources and the ability to access those resources and not fall through the cracks.
That's definitely something that we failed at. Like we talk about a universal, comprehensive system of healthcare being one of the defining aspects of a Canadian society, especially in relation to the United States and what have you. But whether it's this, whether it's other care that should be given to marginalized people, or whether it's even just things in general like pharmacare and dental care, we have a lot of work to do to actually build universal healthcare in this country. Sort of jumping off this point, you mentioned that you're an epidemiologist, and I know that you've also done some teaching. And I'd love to know, especially within COVID, but even beyond it, how do you feel that your experience as an epidemiologist, as a scientist, as an educator, will give you an edge as a rookie member of Parliament and play a role in federal government?
There's two things. There is post-COVID recovery. So in terms of what I want to do, we know that there is going to be an injection of resources into the economy. There has to be, because if there isn't, we will go into a deep, deep recession. The economy is going to really fail. So there has to be an injection. It doesn't matter what government. We know that the Conservatives are going to do. We know what they're going to do. We know that they're going to give tax breaks to the rich, the ultra rich, because they believe in a very failed theory of economics called trickle-down economics. We know that the Liberals are going to give huge tax breaks to the mega corporations that don't even pay taxes now. I want to use that money to transition from an oil-based economy to a green economy. And I want to do that in a way that is just. We're not going to put anybody out of work. We are going to support them so that they are able to transition from one industry to a green industry. You can imagine how many jobs that will actually create. We know that in the green economy, there will be hundreds of thousands of good paying jobs. We can imagine at the local level, for example, Queen's University being the center of excellence for green research. We can imagine St. Lawrence College having the ability to assist people in learning new skills so that they can transition from that oil-based economy to a green economy. We can imagine that RMC, for example, being leaders in being able to have their machines, for example, be more carbon neutral, right? These things we can reimagine an economy that will benefit Kingston and be less harmful to the environment. That's one thing I want to do. Because I'm an epidemiologist. My undergrad is in public health and environmental health. I am a huge advocate of ensuring that the environment is properly looked after. And the other thing I wanted to make sure, you talked about, as an epidemiologist, what can I do? The other thing I want to do is to make sure that the next pandemic, and there will be another one, I will guarantee you, because as an epidemiologist of 30 years, I've lived through so many of these. For example, I started my career off when HIV/AIDS was at its worst. SARS, H1N1, Zika virus, Norwalk. All of these things are huge, and And the thing is that we haven't even learned from these. I was talking to Dr. Dick Zaltman, and he said, you know what? Every single one of these pandemics, we have written a report, and he was the leader in writing the SARS report Aftermath. And he said, we just don't learn from our previous mistakes. We just make them over and over again. And it has to go beyond just, can we ramp up vaccines? Because it took a year and a half to really get to that level. We have to have PPEs, personal protection equipment. We were so short. We fell so short. And putting people who are sworn to take care of us, we were putting them at risk. And we were burning them out, right? So what I want to do is to make sure that whatever pandemic, we learn from our mistakes. And when the Prime Minister was asked, what would you do differently? He said nothing. My dad always said, Vic, if you don't admit your mistakes, you will make them over and over again. And beyond that, people really don't judge you on the mistakes you make, but how you make amends for those mistakes, right? And we need to make amends for those mistakes. Use this as a learning opportunities, and it goes beyond just what is on the top of our minds. We know that women, for example, suffered the most during this pandemic. We know people of color, we know indigenous people, we know the elderly, we know small businesses suffered. And how do we develop social policies? And how do we develop social policies so that the next pandemic, we minimize the effects, or at least equalize the effects on these people? We have to have a good social housing policy, because we know when there was density, we know in terms of housing, we know that the virus propagated, right? We also have, we also have to do things. We cannot, one thing this pandemic has taught us is that we are not isolated regionally or even nationally. We are a global community. So if we don't invest in things like foreign aid, we will, if this virus, for example, occurs in a developing country, it is only a matter of time before it gets to us. So foreign aid is not only an ethical thing to do, but it is an investment in our own well-being. And if you think of it that way, then the first thing we will not cut when we are in an economic crisis or we want to balance our budgets is foreign aid. It is just self-defeating. So as an epidemiologist, I understand how all of these things work together, right? And we are able to understand how, if we understand what the issues and problems are, then we can come up with a solution. But until we go to the root cause of these problems and issues, the solutions that we make are only superficial. They will do nothing. I would say it is like a landlord who has a home, and basically the foundation is falling apart. There's mold in the walls, and what do? They just cover it up with a fresh painted coat and said, "Look, we've done something." But it's only a matter of time before the foundation falls apart again, before the walls become moldy again.
We definitely have a lot we need to do, whether it's the social determinants of health, whether it's the fact that because Conair Labs was was privatized under previous governments and then never renationalized, that we have a severe deficit of producing essential medical goods, one, domestically, and two, beyond the profit motive. I think that your experience as an epidemiologist brings that forward. And I agree with you that whether it's a pandemic or whether it's just the broader spread of more typical illnesses that, again, as you note so clearly, are connected to social and political and economic injustice, I think that perspective is very important. So the question is, why do you feel the NDP in particular is the political vehicle to achieve these objectives here in Kingston and here and more broadly at the federal level? Like, what about the NDP as a party and as a a body with a platform, as a leader with Jagmeet Singh? Why do you feel optimistic that they can bring that change?
One of the things that the NDP has done and has shown in the past is that we invest in people, not business. If, for example, we invest in social housing, we invest in an education system that gives everyone the opportunity to access secondary education. If we work with our Indigenous communities to provide good quality drinking water and work towards a meaningful reconciliation, if we invest in these things, they are social benefits that everybody will enjoy. What the NDP sees at is that these aren't what we're doing isn't handouts, it's hands up. And basically, if we invest and eliminate things like poverty, if we invest in mental health, if we invest in dental health, these are things that will pay off eventually in the savings that we will see. Instead of treating, what we want to do is to prevent. And these social policies is just one of the ways that we will prevent something from happening. And one thing that this pandemic has taught us is that if we can prevent something from happening, we don't have to treat it later. And it is going to save us a whole bunch of money downstream. In public health, we have this model of upstream versus downstream. Upstream is prevention, downstream is treatment. And if we can prevent upstream people from getting diseases, we will save money at the treatment level. The other thing too, in terms of having the NDP as your government, we have shown time and time again that given the opportunity, we will keep our promises. If we say that we're going to do something, we will do it. Just going back to the environment, which is one of my passions, as you know, Christo.
Yes, of course.
So if, for example, the rhetoric of the Liberals are to believe we will have electric cars by the year 2030, and then we will be carbon neutral by the year 2050, then why are we investing in a pipeline, an oil pipeline, that will be redundant? That will be redundant. If we listen to the rhetoric, it will be redundant in less than 8 years. And these things will, they are amortized over hundred of years, right? Or at least 100 years.
Yeah, well, I mean, it's either they're lying about their commitment to the 2030 and 2050 goals, or they are offering a parachute payment to the fossil fuel industry, or maybe a bit of both.
Yeah, that's exactly what it says. Now, you have to understand that what we're going to do is, the carbon tax, for example. And what the Trudeau government has said is that, well, this is a small payment for the implementation of the carbon tax. This Well, no. We are the government. We are going, if the NDP will be government, we are going to put carbon taxes in place because that's what we do. And we are going to take the $3 to $4 billion that are invested in the oil companies now by the Liberals and move it to research and development and implementation of the green economy. This is what we have to do. We have gone from, we've gone up 1 to 1.5 degrees in global temperature. And look at the consequences with the fires in BC, the smoke in Alberta, the hurricanes that is going on in the Caribbean countries and the southern United States. The farmlands are turning into desert as we speak. Floods are happening all of the time. We have to take this seriously because the consequences of going up another degree, which is estimated, scientifically projected to happen in another 70 to 100 years. And that's not a long time from now. That is our grandchildren that we're talking about. The ramifications will only get worse and worse and worse. And this will not be a livable planet for our grandchildren and great-grandchildren. We have to do something now. And the NDP is in a position, and as an epidemiologist and an environmental activist, I will ensure that our party sticks to their commitment in terms of preventing this horrible crisis from happening.
We need a Green New Deal, right? Like we need that. And while I think there are many people reasonably saying that even the NDP could be more ambitious, and we can always have that discussion, the reality is it's the only party that is combining a pursuit of environmental justice with a pursuit of social and political and economic and indigenous justice. And I think that is maybe the biggest selling point of the NDP. And I think, Jagmeet Singh has said, part of the plan is we're going to tax the rich, tax those who can afford it to pay for the programs that help people. One final question is, why specifically have you chosen electoral politics? People get involved and do great things in a variety of ways, whether it's in their careers or volunteering, working for community organizations, but politics is one of the ways you can make the world a better place. Why at this point have you chosen to, run for the NDP federally here in Kingston?
Throughout my career, I have taught evidence-based decision-making. So, for example, I was the director of research at Hotel Dieu. I was the director of research at NOFM, which is the residency program in northeastern Ontario. And my job was to ensure that physicians and nurses and midwives use the best evidence to treat their patients. And one thing I have found in politics is that we do not use the best evidence to make proper policy decisions. And the only way to change that is by becoming a politician. When you get into politics, it is all about what I can do to get elected in the next 4 years. I do not want that to happen. I want I don't want scientists to lead this process. But what I do want is for us, when we implement something, we use the best available science to see whether or not what works. We go to countries where, when they have implemented these policies, it has been shown to work. So, for example, we know that they are social policies that European countries have invested in, and the payoff is absolutely magnificent. The other thing I want to do is that when a policy is in place, we never evaluate whether the policy is actually making a difference in the lives of our citizens. I want Kingstonians and the Islanders to have a great life based on the policies that the NDP have put in. So, for example, dental care is one of those policies that we are going to implement. But if there are so many holes in that program that it isn't meeting the needs of the people who need that service, we need to understand that people are falling through the cracks. And the only way to do that is by talking to people, understanding, evaluating those particular programs. And only then, once we know where the gaps are, we can actually mend and legislate those gaps. So that's why I became I want to become a politician, and actually became a politician, to ensure that whatever we are doing, we need evidence to show that the lives for our citizens are better, and that the payoff is what we think it is, and there is no subsequent consequences, negative consequences to those particular programs. Because we know good intention, programs that have good intentions don't always, they have negative consequences sometimes, right? But if we don't know what those are, if we don't talk to our citizens, it's funny, because it seems to me that the only time we see politicians are at election. They want to get reelected, so they come out of the woodworks. And I can assure you that when we put policies in place, I will go to homes, I will knock on doors, I will have community groups meet with me to say, Vic, this great program, but you know what? It could be better. And the question is, I would ask them, is what are you experiencing? It's the good, the bad, and the ugly. What is good, we will keep. What is bad, we will change. What is ugly, we will get rid of. But we can only do so if we talk to the people, if we talk to the citizens that uses those programs. And my frustration with all of this is that as politicians, we do not do that. We might have somebody call our office and then say something like, "Oh, geez, you know what? We passed. This is a provincial issue, not a federal issue, and we have passed that to our MPP." Rather than saying, "You know what? This is a complicated issue. We need. There is 3 different levels of government and agencies that can fix your issue. We are going to call a meeting of all of these constituents, and we will ensure that whatever problem you have, we will work together as levels of government and levels of bureaucracy to fix your problem." We're never going to say, "You know what, it's a municipal problem." We will never say that. I will never say that as a politician. I will say, if this is a municipal problem, guess what? We are going to talk to the municipalities to see what we can do in order to fix this. I am getting emails now. I got one this morning where a young lady is advocating for her mom who is living in a place in a home, affordable housing home, but she's in a wheelchair, and there is very few wheelchair access to affordable homes. And the issue is, is this a municipal jurisdiction? Is it provincial? Is it federal? It doesn't matter what the Constitution says. This is a human being, and we all have responsibilities to help her. And my frustration, and the reason I'm joining this adventure in my life, this new adventure, is because I want to help people. I want to help people, not by pushing it off to somebody else, but by being involved and working together with others. And I know how to do that because I've done it throughout my career. Working with others to make problems go away for our citizens.
Well, Vic, this has been fantastic. I especially like what you said about how, if you were to become the member of parliament, if the NDP was to form government or both, that you would, not only be pushing for those policies, but understanding that even your own party can always do better. And I think that's an incredibly important message, and one that I don't think we see from the current governing party. Before we finish, let people know where they can find you, the campaign office, the website, getting signs, all of that. Let us know.
Actually, if you go to our website, the easiest way to just go to our website, it is vicndp.ca. You can email me through that website. You can find our address. We're near the Loyal Oarsman. Everybody seems to know where that bar is, and it's a great landmark.
It's right across the street from the Rio cans, the Rio can, right?
Exactly.
Yeah.
Anyway, it is just absolutely fantastic experience for me, and I cannot thank you enough. If you want more information, please go to our website. Again, it is vicndp.ca. And we look forward to working with anybody who wants to work with us. Anybody who wants to donate to the campaign can do it through that website. If you want to sign, you can actually do it through the website. We are welcoming any help that we can get. This is a very important election. And Christo, I don't know if you know this, but if you go to... I can't remember the particular website in terms of they have a lot of polls, but they had us at 0% maybe about 2 months ago of winning. Then it moved up to you have a chance, to there is a likelihood that the Liberals will win. So every day, the probability of the NDP winning this particular riding is going up and up and up. We are now within the margins of error. And it isn't the big margins of error. We are within a couple percentage of the Liberals.
I mean, I think that's a great point. I mean, Kingston, Barrington Walker ran a fantastic campaign for Kingston last time, and that was the best result for the party federally in the entire history of the CCF NDP, going all the way back to the 1930s. And in Ontario, our ridings are mirrored provincially and federally. And so if Ian Arthur, our great member of provincial parliament, can win in this riding, then we can as well. And I am very confident that every day we're closing the gap on the current incumbent, and hopefully we'll beat him at the finish line.
Thank you, Christo. Thanks so much to you and your listeners.